how to take your telehealth program to the next level on this week's Medical Economics Pulse.
But the advantages of telehealth are not to be minimized. By allowing greater access, like I mentioned before, patients may feel a little bit more comfortable and relaxed during a visit, and they feel a little bit more comfortable knowing that they don't have to get every last thing in on this visit. And so some of those questions that you may have may be able to be answered in more depth and more completely and more comprehensively.
The United States continues to grapple with the COVID-19 pandemic, but many physician practices are reopening to in-person care. In the last 2 months, physicians and patients have relied on telehealth for most appointments, and surveys have shown that many patients are very satisfied with their virtual care. So, now that practices are reopening, what can physicians do to continue to use telehealth while seeing patients in person? Today, we're joined by Dr. Peter Alperin, an internist in private practice and a vice president at Doximity, to discuss telehealth best practices going forward. Dr. Peter Alperin, thank you very much for joining us today.
Thanks for having me.
So the first question I wanted to ask is just a basic, the definition of telehealth. You hear a lot about what this term actually means. Can you explain in your mind what telehealth means?
Yeah, so telehealth versus telemedicine is is some of the ways that I think about it. Telehealth is a broad term that really, in my mind, refers to all the different things that you would do through a video platform that's both synchronous and asynchronous, right? So if I'm having a conversation with a patient, or if I'm even having a conversation with another physician, it can also involve getting forms or a variety of other things that maybe are asynchronous. So those sorts of activities of authorizations, et cetera. And then when I think of telemedicine, I think really the specifics of having that clinical visit with a patient. So that's kind of the way that I separate it in my mind.
What are some misconceptions that you think physicians out there have about telemedicine, telehealth, sort of the concept of remote care?
Yeah, it's a great question, and we've had a lot of those myths and misconceptions probably shattered over the past 2 months. I think the first misconception is that telehealth is something that you can't incorporate into your practice easily. I think it is been shown, and I think we've proven that it's something not only that physicians of all kinds, both primary care, specialty, employed, private practice, can incorporate into their practice easily if they just put a little bit of thought into it. And like they say, necessity is the mother of invention, and that's really what I think has driven the conversation now. Another misconception is that telehealth is somehow substandard care, and that it's somehow you're not giving the patient as great a clinical experience. There's no question that there are a wide variety of things and a good number of things that an in-person visit is required for. But that said, as doctors have thought about how telehealth has worked for them, they're discovering that patients like it, and actually for a good number of visits, for the physician themselves, it's proving quite effective.
You brought up obviously what's going on right now, the COVID-19 pandemic, and a lot of physicians are learning about telehealth on the fly. And I just wanted to get a chance to get your thoughts on how you think sort of using telemedicine has done. We've heard from our readers and our audience that they're actually more satisfied with conducting telehealth than maybe they would have thought before this happened. So can you talk a little bit about sort of what you've learned and what you've heard from physicians about how telemedicine has performed during this pandemic?
Yeah. So what I've discovered in my own practice, and what from the dozens of physicians that I've spoken with, is that setting up that visit through telehealth really has done a couple things. On the patient side in particular, it's let the patient have more contact and more connection points with the physician. One of the tricky things about having a patient come into your office is that it can be difficult to schedule. It can be hard to get on the calendar, so to speak. And what ends up happening is that a lot gets compressed into that visit, and a lot of questions get answered. And every physician will talk about as the patient's walking out the door, the one more thing that turns out to be another 30-minute conversation. So the appointments themselves can be very compressed, and there's just a lot to do, particularly in primary care. And on the physician side, you're now able to have an additional touch point with a patient to maybe clarify some of the things that came up during that visit. So maybe clarifying some of the new medications that you talked about, or the side effects related to a medication, or some other particular clinical instructions that you had for the particular visit. And so those are some, I think, really important places where telehealth has improved care. It's also improved access, right? So access in general is something that is always an issue. And if a physician or a physician's practice is able to get, have a wider number of patients that they're able to take care of, or a greater number, that can only benefit both sides.
I kind of want to go a little more in depth on that in terms of sort of when you're doing a telehealth or telemedicine exam, what are some of the advantages of that and what are some of the limitations? Obviously, it's one thing to be able to be in a room with somebody. So you kind of talk through some of the advantages and some of the limitations of that type of appointment.
Yeah, so I think the easier side are what are the advantages of the in-person visit to sort of set the stage. You know, the physical exam, there's no question that it is easier to do in person. That's how physicians have been taught for hundreds of years, and that is how the exam is designed. And there are certain things which there is no substitute, and that drives those visits that need to come into the office. So there's definitely an advantage in the office when it comes to that aspect of it. Also, being able to read a particular patient can sometimes be a little bit easier. You know, a lot of communication is nonverbal, and it can take a little bit of practice when you're having a conversation across a camera. But the advantages of telehealth are not to be minimized. By allowing greater access, like I mentioned before, patients may feel a little bit more comfortable and relaxed during a visit, and they feel a little bit more comfortable knowing that they don't have to get every last thing in on this visit. And so some of those questions that you may have may be able to be answered in more depth and more completely and more comprehensively. The other thing is that you can, by talking to them more, you can actually see the longitudinal nature of some of the changes that you're making in terms of their care, say a treatment plan with a medication or a device. You can catch them in their own natural environment, which can be advantageous in certain circumstances. So like everything else, it's a tool. And that tool has to be used, appropriately, and you have to understand the advantages and the disadvantages of it.
Right now, a lot of the regulations around HIPAA security have been relaxed, loosened to a great extent, where physicians can essentially use whatever type of video conferencing platform that they can to do this. But obviously, patient privacy and confidentiality is crucial. What tips do you have for physicians to manage and make sure that they're keeping these types of considerations at the top of the list while also improving access without having to worry about regulations?
Yeah, so I think implicit in your question are the waivers that have been granted by CMS related to the telehealth platforms that physicians can use during the COVID pandemic. And I think that was a great decision. Let's worry about some of the other things later. Let's just create a system where physicians can get patients seen, and we can help take care of those patients out there. But I will say that it's not going to be too long before those waivers are going to be either rescinded or regulations tightened, or both. And it is, I think, very important for physicians to pay attention to making sure that the platforms are HIPAA compliant. So the technology that you'll utilize in your practice needs to have all the proper certifications, because let's face it, HIPAA is the law of the land, and it is a requirement. And it's there for the patient's best interest, if it's not always the most convenient to be able to comply with. So the things that I would say would be, make sure you have a reputable, partner and vendor partner with your technology solutions. And then other things are, make sure that all the additional things that you're doing for the patient when it comes to, forms and the like, are also over that platform. It's important not to overlook that. So those are probably the most general things that I would answer to that.
Okay, great. In terms of right now, obviously, physicians have been doing a ton of telehealth appointments. Some physicians are almost exclusively seeing patients over telehealth. We're moving into a phase where lots of the economy is reopening and physicians are going to start seeing patients again in their practices. How do you sort of create a workflow that balances seeing patients, going room to room, while also keeping up the good habits of telehealth that you've been developing, essentially meshing the two, the old way of doing things and this new way of doing things together in an efficient way in your practice?
Yeah. So a couple of things. The first thing is you kind of need to set up specific times during your day that you'll have inpatient visits as well as telehealth. But that doesn't always necessarily work, right? Because there may be a particular visit that you need at 10:30 in the morning on a Wednesday, which is the time that you've set apart for in-office visits. So having some sort of triage system is critical. So having that system be in place so that your staff can help understand what are the criteria that you want for telehealth versus an inpatient visit. And then building as best you can, and this is tricky, some flex in your schedule a little bit so that you have those opportunities to do those telehealth visits in the middle of otherwise, having block time. The other thing that's important is, telehealth is here to stay, and making sure that you go with something that's super easy to use and just works will help you not have to fumble around and have that block of time be wasted. If you set up a visit, but the patient isn't able to, use the solution that you have because they're elderly and perhaps they're not that facile with technology, that's a lost opportunity, both for patient care, most importantly, and then let's face it, revenue as well.
In terms of obviously one of the goals for treatment adherence these days is team-based care, and the way to get every caregiver in a practice to be working at the top of their license and working as a team to treat patients. How do you integrate team-based care with a telehealth approach? What are sort of the different roles for different types of caregivers while using telehealth?
Yeah, so I think the pandemic has really shown how important that is. Having everybody, as they say, have everybody be able to do their job and do it well. So having a solution that allows everybody to participate on the platform, like the Doximity dialer platform, is one that comes to mind. That allows everybody to have an account and be able to have contact with patients. So being clear with patients about when you might call them, having that be someone's job and role in the office to help call the patient, set them up, and then have the physician be able to talk with them as well. And also understanding what are those types of clinical those clinical conditions that are most amenable to telehealth, and importantly, really educating the staff on what are the things that can't be taken care of through a telehealth visit and need to be bumped to perhaps an inpatient visit. Those are the kinds of things that if you're working with, if you have a nurse practitioner in your office or, an RN, that's absolutely something that they can do to be able to practice up to the top of their credential. And then, having the medical assistants, et cetera, be able to handle some of the non-medical clinical things to help that patient either at the beginning or at the end of the visit.
Okay, great. In terms of patients with chronic conditions, patients with diabetes, patients with heart conditions, asthma, COPD, all the really tough chronic conditions that primary care physicians are treating on a daily basis, what role does telehealth have for managing those conditions? What's the best use of telehealth with those types of patients?
Yeah, no, that's a great question, and I think a really important point. It's the chronic conditions that you outlined, and there's of course others. Really, the key element that distinguishes those conditions versus, say a cut on your finger, et cetera, is that they're longitudinal conditions that require long-term management. And there's no better solution for long-term management than multiple touch points with the patient. And so telehealth and telemedicine allows you to have those multiple contacts with the patient in a much more efficient way that's convenient for both you and for the patient. So let's take, for instance, a patient with diabetes or hypertension. There's a fair number of medication changes that you need to do. You could do some of that by secure messaging, et cetera, but being able to have a 5-minute conversation or a 10-minute conversation with a patient and being able to answer those questions really face-to-face can be huge. And you can learn all sorts of things about the patients perhaps are taking their medications wrong. They're taking one medication at the wrong time of the day or before a meal or after a meal, really depending upon the particular clinical scenario. And so that ability to contact the patient more frequently, it sort of harkens back in a lot of ways to sort of the era of the home visit. Obviously, it's not the most efficient way to take care of patients, but there's a tremendous value to seeing a patient in their own home environment. And the telehealth approach and a telemedicine visit allows you to have that visualization, with the patient, and talk to them more often. And you might learn some things that they may have otherwise forgotten because, otherwise your next inpatient visit wasn't scheduled for 2 months from now.
What advice do you have for physicians to feel more comfortable on video? Obviously, they're very used to being across from a patient in an exam room. But, if you
Right.
change like sort of the situation, it often changes how people feel. What advice do you have for that to learn about that interaction and get used to it?
Yeah. Yeah, no, it definitely takes a little practice. And I think that's the key. Just as physicians in medical school learned how to, practice the neurologic exam or the cardiovascular exam or what have you, learning to communicate with the patient on video is important. So what I would say is, figure out where in your office you're going to do it. Are you going to do it from your personal office, or you can have a different room? Make sure you have if you can do it and you can set it up, have a dedicated system that's setting up to allow you to do that. Oftentimes you'll use your phone, and that's an important thing to note. But if you are using your phone, which is oftentimes very convenient and the most appropriate way, maybe always sit in the same place. Think about the lighting that you have. Think about how you look on camera. So what all of that really comes to is do a little bit of homework, set yourself up, see what you look like on video, so that you're able to sort of, oh, wow, I notice that perhaps there's a big shadow that's coming across your face. You also need to think about the audio as well. Really think about how you're going to be able to hear a patient clearly. And so have something dedicated to that. It really comes down to just spending a little bit of prep time. And it really doesn't take very much. You can be set up in 20 minutes if you're really good at it, and otherwise an hour, which really isn't that much when you think about it.
On the other end is the patient, and most people are pretty versed in basic technology, smartphones and all that stuff, but obviously you're going to have patients that might struggle with technology. What's the role of a physician in their practice and their staff in helping patients access telehealth from that standpoint?
Yeah, so I think this is a really key point that was underappreciated by physicians, and I don't think it is as underappreciated now. A lot of the communication platforms and telehealth platforms that are out there are not necessarily the easiest thing to use. And I think ease of use is critical. Something that's easy, safe, and reliable is really what you're after, because a lot of the patients that you're going to be taking care of may be elderly. And you want something that works across all platforms. So whether that person has a smartphone or not, whether that person has a Mac or they have a PC-based system, it needs to work across everything. And ideally, you want a system that doesn't require the patient to have to download something. This may be the first time that they've done that, and they may not understand that their computer won't let them download something because their permissions are set up, or they haven't rebooted their computer for 3 years, and it's got a lot of updates that haven't been done, and so things aren't compatible. Like I mentioned earlier, we've designed a system at Doximity, the Dialer Video, which works on any platform, and I really think that's the key thing. It just works. You need to send a text to somebody, and you want that visit time to be as fruitful as possible, because otherwise that patient will be frustrated. You'll be frustrated. You'll have to reschedule. You won't be able to bill that visit. And so again, easy, safe, and reliable.
In terms of evaluating whether a telehealth, both a visit and then a larger telehealth program is successful, what advice do you have for physicians to get feedback from patients and to make sure they're continually learning what patients want, how to get better, those kinds of things? How would you go about evaluating a telehealth program?
Yeah, no, that's a good question. I think it's like anything else. I think if you are comfortable enough and, frankly, have humble enough to say, to admit to your patients, hey, this is as new to me as it is to you. How did I do? What did you like? What did you not like? That's probably something that could be a little bit easier done in person, particularly with patients maybe you've known for a long time. But I really think just soliciting direct feedback, I would probably do it in person if you can, maybe at a subsequent telehealth visit, or if you have the opportunity at the end of the visit, ask the patient, so how did this go for you? Were there things that you thought we could have done better? Were there things that you liked about it? How did I sound? How was the volume? Did you find the system that I've employed easy to use? And the like. And I think what you'll find is patients are frankly quite flattered when you ask them to how that you can improve. And I think it shows your humanness. Frankly, that's something, that vulnerability is something that patients, I think, really bond with their physicians over.
Is there anything that you think it's important for physicians to know about telehealth or telemedicine or remote care in any way that we haven't discussed that you think it's important to mention?
I think the most important thing that, and we've talked about a lot of this, but again, the telehealth that you're going to incorporate in your practice really requires that you, are thoughtful about where you employ it and how you employ it. And using a platform that you know that is always going to work for your patients, that simply just works, I think is critical. Like the Doximity dialer platform that's available to so many physicians nationwide. And I think that if you put the same amount of thought into that as you put into all the other aspects of your practice, then it will be successful. And then, as you mentioned before, soliciting that feedback, but also being able to incorporate that feedback into changes and being willing to be flexible during this initial period where, frankly, every practice in the country is ramping up, I think will probably provide the best pathway to success.
Dr. Peter Alperin, thanks very much for joining us today.
Thank you so much for having me.